Myasthenia gravis, the receptors at the muscle surface are destroyed or deformed antibodies that prevent the normal muscular reaction from occurring, and the causative factor is unknown, and but the disorder may have a genetic link. The receptors of the muscle surface are destroyed or deformed by antibodies that prevent a normal muscular reaction from occurring, and the causative factor is unknown, but the disorder may have a genetic link. Coming to the risk factors, the risk factors of myasthenia mainly include female gender and age under the 40 years, female gender and age under 40 years, and the male gender and age over 60 years, and other autoimmune disorders. Which are the other common autoimmune disorders? We have already learned regarding the GBS, and hope you remember regarding the SLE. These all are some of the autoimmune disorders, and which may be affecting the immune system, and in combination with that may be occurring. So the main risk factors are female gender and age under 40 years, and male gender and age over 60 years, and other autoimmune disorders. Here discussed regarding the risk factors, and which will include the mainly the male gender and age under the 40 years, then the male gender and age over 60 years, and other autoimmune disorders. These are some of the main risk factors. The factors that can worsen the myasthenia gravis, that including fatigue, then illness, then stress, extreme heat, and some medications. These are the main things which can increase the burden of the myasthenia gravis. Fatigue means once the body is having fatigue, then again there is an autoimmune attack, means then the body will be getting more worsen, and life may be getting threatened. And illness and stress, everything will be increasing the impact of the particular disease on the human body. And the extreme heat means once the heat is extreme, means depending upon the climate changes, there will be automatically there will be body reactions, and associated with once there is myasthenia gravis, then that also will be getting worsened. And some medications such as beta blockers, calcium channels blockers, and the tunin, and some other antibiotics, these all will be increasing the impact of myasthenia gravis. These are some of the main factors which can worsen the myasthenia gravis. Then coming to the pathophysiology, means there is autoimmune attack, and we are discussing the reactions. And there is a myasthenia crisis, means there is a problem in the neurojunctions, then there will be bulbar weakness and the ventilatory muscle weakness. Once there is a ventilatory muscle weakness, that will be leading to decreasing the tidal volume, then decreasing the functional residual capacity. That decreasing means there will be increasing the hypoventilation, and the dead space and VQ alteration will be there. That is, ventilation, perfusion, alteration will be there, and which will be resulting in hypoxemia or hypercapnia, and that will be leading to the respiratory failure. Hope you have studied regarding the acid-base imbalances and all, and through that you can identify the hypoxemia and hypercapnia, and in association with that there will be problem with the problem like the respiratory failure will be there. And once there is a bulbar weakness, means there will be having the two pathways, that is accumulation of the secretions of pharyngeal lake, and there will be alterations in sign mechanism and the cough and swallowing reflexes, and there will be resulting in atelectasis and the micro aspirations, increasing the upper airways and the resistance and the work of breathing, and that will be resulting to the pneumonia. These are the some of the things that happening in case of myasthenia gravis. Hope it's clear. Once again, there is myasthenia gravis, then there will be two pathways, that is, once there will be bulbar bulbar weakness, and once there is ventilatory muscle weakness, and once there is a ventilatory muscle weakness, that will be ending with the respiratory failure. And once there is a bulbar weakness, that will be ending with the pneumonia. These are some of the things what's happening in case of a myasthenia gravis. Then coming to the signs and symptoms, mainly there will be diplopia and stenosis will be there. The diplopia and stenosis are some of the main signs which we can see. Means there will be muscle weakness. In associated with that, all the which part is involved, that particular part will be having the specific signs and symptoms. Then there will be weakness of the muscles of the face and the throat, and generalized weakness will be there. The weakness of the facial muscle results in bland facial expression. In the laryngeal irritation causes voice impairment and dysphonias, and increase the patient's risk for choking and aspiration. These are some of the things. The weakness of the muscles of the face and the throat and generalized weakness. The weakness of the facial muscle results in bland facial expression. Then laryngeal irritation causes voice impairment and dysphonias, and increase the patient's risk for choking and aspiration. Then there will be generalized weakness of all the extremities and the intercostal muscles, resulting in decreased respiratory capacity and the vital capacity. And myasthenia gravis is purely a motor disorder with no effect on the sensation and coordination. That means the muscle weakness will be there, but there will not be any paresthesia. These are some of the main things in the myasthenia gravis. Then coming to the diagnostic test, one is edrophonium test, that is injection of the chemical edrophonium may result in sudden or the temporary improvement in the muscle strength, and indication that patient may have myasthenia gravis. The edrophonium test means we will be injecting the injection of edrophonium, and that may be resulting in the sudden temporary improvement in the muscle strength. That is one of the tests for confirming the myasthenia. Then the blood analysis. In blood analysis, the blood may be reveal the presence of abnormal antibodies that disrupt the receptor sites where nerve impulses signal the muscles to move. A blood test reveals the presence of abnormal antibodies that disrupt the receptor sites. Means we are already discussed regarding the autoimmune antibodies in the body in the portion GDS, and just similar to that, there will be some antibodies, and that we can detect it through the blood analysis. And the ice pack test. Sorry, there is a mistake. That is ice pack test. And the cooling may improve the neurovascular transmission. Once there is a cooling, that will improve the neurovascular transmission. And in a patient with myasthenia gravis who has scoliosis, and placing ice over an eyelid will lead to cooling of the lid, which leads to improvement of the scoliosis. The neuromuscular transmission will be improving, and once the patient is having a scoliosis and we are applying the ice pack, means the scoliosis will be getting relieved. This is a thing what's happening in case of a patient who have the myasthenia. The repetitive nerve stimulation, we already discussed in the previous portion, and the pulmonary function test. In order to identify the by lung capacity and all the things, we have to look for the pulmonary function test. Then coming to the medical management, mainly we will be using the cholinesterase inhibitors, then the corticosteroids, immunosuppressants, and the plasmapheresis. The drugs will be helping to correct the particular problem, and through the plasmapheresis we can remove the autoimmune the agents which are attacking the immunity, and we can transfer pure blood to the human body. That is, or we can clear the blood of the chemicals or the agents which are harming the plasma, means harming the immunity, and we can clear the plasma of the agents. In the surgical management, that we can do with the transcervical thymectomy incision, and we can do the things like that. Thymus gland can be removed, and which may be helping to the specific problem, whichever problem is having, that we can correct with the help of the surgical options. In the dietary management, mainly we have to encourage the patient to reduce the protein intake of 10% of the total calories and replace the animal protein as much as possible with plant protein and eliminate the milk and milk products and substitute other calcium sources. And eat more fruits and vegetables and make sure that they are organically grown. And these are some of the dietary advices, and we have to eliminate the polyunsaturated vegetables, oils, margarines, vegetable shortening, all particularly hydrogenated oils, and all foods such as the deep fried foods that may contain the trans fatty acids, and use extra virgin or olive oil as your main fat, and use the ginger also. These are some of the dietary advices. And coming to the nursing management, we'll be discussing regarding the main signs and diagnosis, and one is ineffective breathing pattern. When the patient is having the respiratory problem, then this one is suiting. That is ineffective breathing pattern related to intercostal muscle weakness and impaired verbal communication. Means once there is a weakness of the voluntary muscles which is controlling the verbalization or vocalization, then there will be problem with the impaired verbal communication, that is related to weakness of the larynx, mouth, pharynx, and jaw. This is one of the other things. Then impaired physical mobility related to voluntary muscle weakness. Impaired physical mobility related to voluntary muscle weakness. The risk for aspiration related to weakness of the bulbar muscles. Then disturbed sensory perception related to ptosis and decreased eye movement. These are some of the main diagnosis, and you can manipulate with the nursing interventions that we can opt for the such patients and in case of a severe myasthenia, and you can go with the other things.